Welcome to the Neuromusculoskeletal Quiz. So the format for tonight is going to be 5 rounds of 5 questions, and the goal is to test your neuromusculoskeletal skills and understanding across a range of different topics. At the end of every round, so at the end of 5 questions, I will review those answers and try to explain the clinical significance and why you should know that answer in the first place. This format works so much better if you commit to it. So if you get a pen and paper and commit your answers down to that paper. If you think them in your head, when you get them wrong, you'll convince yourself, oh, of course, that's what I meant. But if it's on paper and you see yourself having to cross that answer out, you will learn more from it. Equally, if you're a superstar and you get it right, you'll feel great and you get some dopamine, some endorphins, and you'll have a better time. So enjoy it and let's see how you get on. So question 1. Also, I've taken the time to enjoy the powers of PowerPoint, so I do apologize for that. Question 1. In muscle testing, what does grade 3 represent? So in muscle testing, what does grade 3 represent? I'm going to give you about 20 seconds for each question. And that is your standard SMR, motor exam. That's not any special technique. Question 2. A patient with a previous history of radiculopathy returns to your clinic. The pain travels from his elbow to his little finger. On examination, he has a lost sensation in the 5th finger and half of the 4th. He also has a weakness of the hand. Neck range of motion is full and pain-free. What is the lesion and where? So the pain travels from his elbow to his little finger. On examination, he has a loss of sensation in the 5th finger and half of the 4th. He also has weakness to the hand. Neck range of motion is full and pain-free. What is the lesion and where? Question 3. There are 31 pairs of spinal nerves. How many are in the cervical, thoracic, lumbar, sacral, and coccygeal levels? There are 31 pairs of spinal nerves. How many are in the cervical, thoracic, lumbar, sacral, and coccygeal levels? Question number 4. In the case of severe contusion, stretch, or laceration of a nerve, how many centimeters per month can the nerve regrow? So in the case of severe contusion, stretch, or laceration of a nerve, how many centimeters per month can the nerve regrow? And we're assuming in the kind of healthy population. And question 5, the last question for this round. What percentage of patients referred to hospital for headache have a brain tumour? So what percentage of patients referred to hospital for headache have a brain tumour? 0.1%, 1%, 10%. So that's the end of round 1. Let's look at the answers. So in muscle testing, what does grade 3 represent? It's power to move a joint against gravity, but not resistance. So 0 would be there's no muscle activation there at all. You can't see anything, can't feel anything, can't get any reaction from that muscle. Grade 1 would be there's some sign of muscle activation, but no movement. So you might see a muscle twitch, but there's no movement of that muscle at all. Grade 2 would be that there's some sign of muscle activation, maybe some movement when you remove gravity. Grade 3 would be that there's muscle activation and a range of motion against gravity, but they would fail against any resistance. Grade 4 is that they have a full range of motion and they can tolerate some resistance, but you're still going to beat them. And grade 5 is normal, that they're able to fully activate the muscle, full range of motion, and they're able to lock that muscle out against you. What's just happened? Oh my god, this is getting so boring. Well, don't. Okay, so just. So. So question 1, in muscle testing, what does grade 3 represent? The answer, of course, is power to move a joint against gravity, but not resistance. So grade 0 would be there's no sign of muscle activation at all. So it doesn't matter, you can't feel it or see it, there's no movement in that muscle at all. Grade 1 would be that there's some sign of muscle activation, like a twitch, but there's no movement of the joint. Grade 2 would be that there's signs of muscle activation. They can move the joint again, with gravity removed, but not against gravity. Grade 3 would be that they can move the joint against gravity, but not against resistance. So as soon as you give any resistance, they would fail. Grade 4 is that they can move, they have a full range of motion and they can move the joint against gravity and some resistance, but you still beat them quite easily. Grade 5 is normal. They have full range of motion, able to fully activate the muscle and lock the muscle out. Question number 2, a patient with a history of radiculopathy. Pain travels from his elbow to his little finger. On examination, he has a loss of sensation in the 5th finger and half of the 4th. He has weakness of the hand. Neck range of motion is normal. So what would your differential be? So with cubital tunnel syndrome, so it's an ulnar nerve entrapment at the elbow. Classic symptoms would obviously be pain at the elbow that radiates into the hand. And we're going to lose that sensation in the 1/2 fingers, but remembering it's the palm and the fingers, and it's on the palm aspect and the dorsum of the hand. When we're looking at muscles, there's a whole bunch of stuff you could do, but the thumb is a really good one for the looking at median, ulnar, and radial nerves. So for the ulnar nerve, about 70% of that pinch comes from the ulnar nerve. So they should be able to pinch. If they can't, they're going to use the anterior interosseous nerve, which is a branch of the median nerve, to give you that pinch. So basically, ulnar nerve is going to adduct the thumb. So you could do this kind of thing as well. Number 3, there are 31 pairs of spinal nerves. How many are the cervical, thoracic, lumbar, sacral, and coccygeal levels? So, of course, there are 8 cervical ones. Remembering that they initially exit above the vertebra. So C1 exits above C1 vertebra. The C7 nerve root exits above the C7 nerve root. But because we have that tricky C8, that's going to exit below C7, which then forces, obviously, the T1 nerve root to exit below the T1 vertebra. That's going to happen all the way down, and that's why the L5 nerve root comes out below L5. We've got 12 thoracic, we've got 5 lumbar, 5 sacral, and 1 coccygeal. In the case of severe contusion, stretch, or laceration of nerve, how many centimeters per month could we expect it to regrow? So in a healthy person, we're hoping it's about 3 to 4 centimeters a month. If you said an inch, that's probably acceptable. But remembering that things like smoking, alcohol, older populations, all kind of things can affect that. But we're hoping for that about 3 to 4 centimeters. It's important, it's relevant, because you can look at the nerve will not just continue to heal forever and ever and ever. We want it to get done as fast as possible. So if a nerve only has a short way to go, let's say I've damaged my brachial plexus, my upper brachial plexus, and I'm just trying to get innervation back to the proximal shoulder, great news, that's not many inches away. Whereas if I've damaged S1 and I'm 6'4" and it's got to go all the way to my dorsum of my foot, that's a long way for that nerve to regrow. The chances of getting the whole way down and fully recovering is not as good. For the same reason, short people rejoice. You have less far for that nerve to grow. Whereas giants, bad news. You don't want to be damaging those nerves. And what percentage of patients referred to hospital for headache have a brain tumour? unfortunately, it's very small. So it's only 0.1%, which is not what the public believe. I had a patient just this week tell me, I asked him as part of his neck pain, does he have any headaches? And he said, oh God, no, it's not like a brain tumor. Don't worry about that. No, I have no headaches. Like I know that if it was headaches, I'd be really worried because that's a brain tumor, but I do not have any of that. So I'm fine. It's like, where the hell no. Anyway, I didn't have the energy to correct him, but just, that's good news. But that's what the public believes. So this is why your cranial nerve exam is so important, because when patients come in with neck pain, it's really worth really looking at this stuff and then telling them, good news, I can't see anything broken. I'm not worried that it's a stroke, a brain tumor, or anything like that. And quite often you will literally see all that tension that you've been feeling in neck and shoulders will suddenly drop, and they say, oh, thank goodness, are you sure? Because when I had an aunt who died from brain tumor, and you say, yeah, no, it's fine. So again, that's another reason why your cranial nerve exam is so important and so valuable, just that reassurance. And that's, to be honest, why the whole of the neurological exam is so valuable. It's just the ability to say to someone, I've looked, I'm competent, you've not got something broken. It's not MS, it's not motor neurons, it's not one of the big news-grabbing, scary diagnoses. So that's the end of round one. Hopefully an exciting start, and hopefully you've done well. Let's go on to round two.